Dealing with difficult people. Tips for resolving conflict. So why does conflict occur? Well, working at a hospital can be a very stressful environment, and this can lead to a lot of miscommunication. Working at a clinical setting, you will deal with a lot of difficult people. This can include other CPs, nurses and management, doctors, and family members and patients. So, how do we deal with this? Well, communication is key. Listening is the number one step in dealing with unreasonable people. Everyone wants to feel heard. No progress can take place until the other person feels acknowledged. While you're listening, really focus on what the other person is saying, not on what you want to say next. Focus on the conversation. Engage the other person in the dialogue. Pay close attention to body language, yours and theirs. Ask questions for clarification. Validate your impressions and acknowledge the message. Always be patient. Here are some bad listening habits that most of us do. We interrupt the other person while they're speaking. We jump to conclusions. We make up our mind before we know all the information. We're compulsive note takers. We don't respond back when being spoken to. We're very impatient. We change the subject. We think of a reply when the other person is talking. We don't observe body language, and that's theirs and ours, and we don't clarify. This will lead to poor teamwork, delay in medical treatment, problems with our patients and their family members, as well as issues with our coworkers. So, how do we fix this? We become an effective listener. We face the speaker and maintain eye contact. We are attentive but relaxed. We keep an open mind. We don't interrupt and we don't impose our solutions. We wait for the speaker to pause, to clarify any questions that we might have. We ask questions to ensure understanding, not to add to the conversation. We try to feel what the speaker is feeling, and we pay close attention to what isn't said, meaning nonverbal cues. Words are powerful. Words can be used to build up a person or tear down a person. We could see this in Facing the Giants, the Death Crawl video. Avoid using trigger words that can add fire to an argument. Trigger words would be like calm down, what you need to understand, relax, and even I'm sorry. I can understand why you feel that way would be a paraphrase that you can use. I can see why you are upset. I want to help find a solution. And how would you like me to fix this? These phrases not only translates that you are hearing what they're saying, but you also want to find a way to help them. Nonverbal cues. Where you communicate through your body language and nonverbal signals affects how others see you, how well they like you and respect you, and whether or not they trust you. Unfortunately, many people send confusing or negative nonverbal signals without even knowing it. The human face is extremely expressive, able to express countless emotions without saying a word, and unlike some forms of nonverbal communication, facial expressions are universal. The facial expressions for happiness, sadness, anger, surprise, fear, and disgust are the same across cultures. Gestures are woven into the fabric of our daily lives. We wave, point, beckon, and use our hands when we're arguing and speaking, expressing ourselves with gestures often without even thinking. However, the meaning of gestures can be very different across cultures and regions, so it's important to be careful to avoid misinterpretation. Body language and posture. Consider how your perceptions of people are affected by the way they sit, walk, stand, or hold their head. The way you move and carry yourself communicates a wealth of information to the world. This type of nonverbal communication includes your posture, bearing, stance, and subtle movements. Eye contact. Since the visual sense is dominant for most people, eye contact is an especially important type of nonverbal communication. The way you look at someone can communicate many things, including interest, affection, hostility, or attraction. Eye contact is also important in maintaining the flow of conversation and for gauging the other person's interest and response. Space. Have you ever felt uncomfortable during a conversation because the other person was standing too close and invading your space? We all have a need for physical space. Although the need differs depending on the culture, the situation, and the closeness of the relationship, you can use physical space to communicate many different nonverbal messages. Your voice, or rather, your tone of voice, is the most important nonverbal cue. It's not just what you say, it's how you say it. When we speak, other people read our voices in addition to listening to our words. Things they pay attention to include your timing and pace, how loud you speak, your tone and inflection, and sounds that convey understanding, such as uh-huh. Think about this, how someone's tone of voice, for example, can indicate sarcasm, anger, affection, or confidence. So, what do we do when we do get into a conflict? We need to diffuse the situation. And how do we do this? We are active listeners. Remember, everyone wants to feel heard and be acknowledged. We need to stay calm. When a situation is emotionally charged, it's easy to get caught up in the heat of the moment. We don't judge. You don't know what the other person is going through. Chances are, if they are feeling lonesome and fearful, if they are stressed and have a lot of anxiety, they're going to be unreasonable and difficult. We need to reflect respect and dignity toward the other person. No matter how a person is treating you, showing contempt will not help productively and resolve the situation. We need to look for a hidden need. What is the person really trying to gain? What is this person trying to avoid? Don't demand compliance. For example, telling someone who's upset to be quiet and calm down will just make him or her irate. These are trigger words. So instead of ask the person what they are upset about and allow them to vent. Saying, I understand, usually makes things worse. Instead, say, tell me more so I can understand better. Avoid smiling, as this may look like you're mocking the person. Don't act defensively. This is tough. You're naturally not enjoying the other person saying nasty things or things that you know aren't true. You're going to want to defend yourself, but the other person is so emotionally revved up, it's not going to help. Remember, this is not about you. Don't take it personally. Don't return anger with anger. Raising your voice, pointing your finger, or speaking disrespectfully toward the other person would add to the fuel to an already heated situation. Use a low, calm, even monotone voice. Don't try to talk over the other person. Wait until the other person takes a breath and then speak. Don't argue or try to convince the other person of anything. Keep extra space between you and the other person. Your instinct may be to try to calm the other person down by putting your arm on theirs or some other similar gesture that may be appropriate in other contexts. But if someone is already upset, avoid touch, as it might be misinterpreted. Saying, I'm sorry, or I'm going to try to fix this, can help and can go a long way. Okay, so scenario 1. The nurse forgot to mention that she was getting an admission in room 20. The patient is now here, and you are doing your vital signs for the other patients. She's looking for you, wondering where you are and how you can do the vital signs. When she finally finds you, you're charting, and she asks, why can't you do anything right? You weren't there when I needed you. What is your response? So, did we diffuse the situation? Your answer should sound something like this. I'm sorry I wasn't there when the patient was admitted. I did not know that we had a new patient, and I can understand how you feel. I'm going to go do the vitals now and report back to you. Is there anything I need to know about the patient before I do the vitals? So, you walk into a patient's room, and the family member is super upset. They're saying that their mom wasn't bathed, that she is sicker than ever, that her bed is unmade, that the room is dirty. How would you handle this? Were we able to diffuse the situation? First, we need to compose ourselves, as in this situation, one can feel attacked. We would say something around the lines like, I'm sorry that you feel that way. Let me see if I could fix this. What would you like me to do? You would help bathe the patient. You would help clean the room. You would then ask your nurse to go speak to the patient's family member if there's anything the nurse can do as well. If this keeps happening and the family member is still very upset, you would ask management to come speak to the family member. Okay, scenario 3. You walk into a patient's room and he is very, very mad. He states, "I'm miserable. I want to leave. I hate this place. No one cares about me. I feel so bad and no one's here to help me." What do you do? So, did we diffuse the situation? So, your answer can go like this. "I'm sorry that you're feeling that way. Is there anything I can do to help you feel better?" Remember, you can put yourself in your patient's shoes. They're in the hospital and they're sick. They have usually no one to talk to. Simple solutions like helping them take a shower or making their bed, even staying for 10 minutes and speaking to your patient can make their stay a whole lot more comfortable. Okay, so you had a very bad shift. It was very long. You are exhausted. You were so busy during your shift that you forgot to throw away the linens. The morning CP comes in and she sees all the hampers a mess. So she finds you and she starts yelling at you and saying, "Why weren't you able to do the hampers? It's not fair for me to get here and do your work too." What do you do? So, did we defuse the problem? This one can be especially frustrating as it's in the end of the shift. No one wants to be yelled at, especially when they're tired. The key here is to stay calm. Express to them that it wasn't your intention to leave the hampers. You simply had a difficult shift and it slipped your mind. Express your understanding for her feelings, as you wouldn't want to pick up somebody else's work starting your shift either. Remember, you're going to deal with different people in the hospital setting. This includes family members, patients, CPs, nurses, and doctors. Remember, communication is key. You need to be an active listener. You need to face the speaker and maintain eye contact. To be attentive and relaxed. Keep an open mind. And don't interrupt while others are speaking. You also need to remember to avoid trigger words like calm down, relax, and things that can escalate the argument. Another thing to be aware about is nonverbal communication, like your facial expressions, body movements and posture, your gestures, eye contact, touch, and space. This will help you to diffuse any situation.